this morning's Health Matters segment, we are focusing on the Black maternal health crisis in the wake of a viral video, a viral TikTok video of a woman in active labor being denied care by a nurse.
Yeah, so our next guest says it's a prime example of why the Black maternal health outcomes are in crisis across our country. So please welcome to the show OB-GYN Dr. Kameelah Phillips. Dr. Phillips, thank you so much for joining us this morning.
Thank you for having me.
You know, I saw this video and I have two daughters, so I've been through this, and I could not believe, and it was just so troubling to see the pain this woman was in. And this video has now become the center of conversation since it surfaced on Friday, because that nurse seemingly was just taking her time as she's writhing in pain. You went to social media to explain why you weren't surprised when you saw this, and why is that?
Yes, unfortunately, I wasn't surprised. I've been practicing for over 15 years, and I can't tell you the countless number of patients through all of the boroughs who have reported such circumstances. I have patients who transfer from the West Coast, South, Midwest, and all patients have reported similar types of events in their own personal lives. So I do believe this is happening regularly to Black women.
Okay, so I guess we're not going to share the sound here, but we need to explain. In the woman in this video, Carrie Jones, had her baby 12 minutes after the video was taken. What kind of complications can arise from delayed care? And is this type of behavior from an intake nurse even proper protocol?
So the type of complications that can happen are profound. This was her third baby, and if she had delivered on the floor, babies can hit the floor and have skull fractures. If she had delivered without OB personnel, no one would have recognized if she was bleeding excessively. Hemorrhage, postpartum hemorrhage, is our #1 cause of maternal death. And so without IV access, which she didn't have, and quick recognition, she could have hemorrhaged very, very quickly. And then finally, if the baby got stuck and there was no one there to help relieve the baby, 5 minutes is a long time and can lead to neurological distress in babies.
Oh my God, that's terrifying. Do you have any update, though, on how Carrie and her baby are doing?
I don't personally have any communication with her, but her mother did post to social media saying that the baby had a bowel movement during the labor and was evaluated for that, but that they're both at home, thankfully, safely.
Oh, thank goodness for that.
Yeah. So the Dallas Regional Medical Center issued a statement in light of this video. Let's read it now. There it is. The safety, dignity, well-being of our patients are always our highest priorities. We are committed to providing compassionate, high-quality care to every person, and we are reviewing this situation to understand what occurred. But, you know, most people are going to be asking, can this nurse lose her job over this incident?
Yeah. So let me be very clear. The overwhelming number of nurses and doctors and hospital staff are excellent and respond to patients in a timely fashion. This case is unique because, yes, she failed to recognize an emergency, respond in time, demonstrate professionalism, and these things, in my opinion, do not meet the level or standard of care that was appropriate at that time.
Yeah, I mean, is there training, though? Are the nurses, the responding physicians, et cetera, are they given training on how you're supposed to handle an incoming patient like this situation?
Oh, absolutely. We are all aware, especially when it comes to obstetrical patients, because there's actually 2 patients that are there. And what I saw in that video did not meet standard of care in terms of her urgency with taking care of either patient.
So what do you think needs to be done then? I mean, if there's already training in place.
Right. So I think, one, we need to get the basics right. Black women are not dying from mysterious diseases. We're dying from very standard complications. And so we need to standardize our practices so that staff is able to recognize and then quickly respond to them. We really need to also confront the racism in the culture of medicine so that people are forced to do better, and we need to fix access and accountability. Black women, on average, are either underinsured or not insured compared to their white counterparts, and we also have more out-of-pocket costs, so that limits accessibility to care. And I see your insert there. Doula care is also really paramount in helping us achieve equitable outcomes.
Yeah, I mean, that's why it's so scary. In New York and New Jersey, it says Black women are 7 to 8 times more likely to die from pregnancy. Yeah, that's scary.
And
it's unacceptable.
Yeah, and I mean, well, I don't mind being a broken record on this, especially when we're singing the right tune here, because apparently most of these deaths are preventable. How can implicit bias be addressed in the medical field?
Yeah, you're exactly right. According to the CDC, 80% of our maternal deaths are preventable. Not could have been preventable, but actually are preventable. So it really challenges us to look at our systems. As I stated, these are standard conditions that everyone experiences. But when you have systemic racism, implicit bias, and delay in care, that is how people die. And that's what we saw, unfortunately, in this video.
Yeah, I mean, like you mentioned earlier, every second counts in this situation. So what can mothers and mothers-to-be do if they find themselves in a situation where they feel like they're not being properly supported by the staff?
I always tell my patients, run it up. And what I mean by that is to ask for a nursing supervisor, to ask for the patient advocate, to ask for the doctor supervisor on call. I always tell them to escalate their concerns and be very clear about that desire for escalation.